Let me be honest with you right now, because what I am about to share with you could genuinely save your life or the life of someone you love. Every single day across America, millions of people over the age of 60 take their medications without thinking twice. They trust their doctor, they trust their pharmacist, and they trust the little pill organizer sitting on their kitchen counter. And most of the time, that trust is well placed. But here's the thing nobody is talking about. There is one medication mistake that is so common, so quietly dangerous, and so completely overlooked that even well-meaning, health-conscious people make it every single day without realizing it. And after the age of 60, this mistake does not just cause discomfort or a little dizziness. It can directly affect your heart. We are talking about abnormal heart rhythms, dangerous drops in blood pressure, and in some cases, outcomes that end in the emergency room. And the most alarming part? This mistake is not about taking the wrong medication. It is not about overdosing. In fact, it is something far more subtle than that. Something most people would never suspect. So if you or someone you love is over 60 and takes any kind of daily medication, stay with me for the next 10 to 15 minutes. Because what I am about to walk you through could be one of the most important things you have heard in years. Now, before we dive into exactly what this mistake is, I want you to understand something important about how your body changes as you get older, particularly when it comes to how it processes medications. Because this is the foundation that makes everything else make sense. When you are in your 20s or 30s, your body is remarkably efficient at absorbing, distributing, and clearing out substances like medications. Your liver enzymes are working at full strength, your kidneys are filtering blood at a high rate, and your digestive system is absorbing things quickly. But here is what happens quietly and gradually as the decades pass. After the age of 60, kidney function typically declines by about 30 to 40% compared to what it was when you were younger. Your liver also slows down, and the enzymes responsible for breaking down medications become less active. On top of that, the percentage of body fat increases while muscle mass and total body water decrease. Why does that matter? Because many medications are either water-soluble or fat-soluble, and changes in body composition mean the same dose that worked perfectly at 40 can behave very differently in your body at 65 or 70. This is not speculation. This is well-established physiology that doctors and pharmacists absolutely know about. But here is where things start to fall through the cracks. Most people over 60 are not taking just one medication. According to research from multiple major healthcare institutions, more than 40% of adults aged 65 and older take 5 or more prescription medications simultaneously. Some estimates push that number even higher when you include over-the-counter drugs. This is what the medical world calls polypharmacy, and it is incredibly common. And here is the critical issue with polypharmacy. It is not just that you are taking more pills. It is that each additional medication you add to that daily routine increases the risk of something called a drug interaction. And some of those interactions can directly affect your heart in ways that are serious and sometimes life-threatening. Now, the mistake I am talking about today is not just about combining two dangerous drugs. It goes much deeper than that, and it involves something that most people completely overlook when they think about their medications. Here is the thing most people do not realize. Timing matters enormously. Not just whether you take medication with food or without food, although that absolutely matters too. I mean the specific time of day you take your medication in relation to other medications you are taking, in relation to your meals, in relation to your supplements and vitamins, and in relation to everyday substances most people never think twice about. And when you get this wrong, especially after 60 when your body processes everything more slowly, the consequences can ripple directly into your cardiovascular system. Let me give you a real-world scenario that plays out in households all across America. Someone over 60 wakes up in the morning and takes their blood pressure medication with a glass of grapefruit juice, which they have been doing for years because they like grapefruit juice and it just feels healthy. Then they take their cholesterol medication at the same time because it is convenient. Then they drink their morning coffee and take a calcium supplement. And later in the day, they might take an over-the-counter pain reliever for a sore back. This sequence of events, which looks completely normal and harmless on the surface, can actually create a perfect storm of interactions that puts serious stress on the heart. And this is not a rare or unusual scenario. Variations of this exact routine happen in millions of homes every single day. Let us start with the grapefruit situation because this is one that genuinely surprises people, and it is one of the most well-documented and yet least discussed issues in senior medication safety. Grapefruit, and to a lesser extent grapefruit juice, contains natural compounds called furanocoumarins. These compounds block specific enzymes in your small intestine and liver that are responsible for breaking down a surprisingly large number of medications. When those enzymes are blocked, your body absorbs far more of the medication than it is supposed to. For some medications, drinking a single glass of grapefruit juice can increase the amount of drug in your bloodstream by as much as 2 to 3 times the intended dose. And the effect is not immediate. It can persist for up to 24 hours because those enzymes are essentially deactivated until your body produces new ones. Now think about which medications are on that list of drugs affected by grapefruit. Statins used to lower cholesterol, certain calcium channel blockers used for blood pressure and heart conditions, some anti-anxiety medications, certain immunosuppressants, and a range of other cardiovascular drugs. When someone over 60 takes a statin or a heart medication with grapefruit juice, they may unknowingly be giving themselves a significantly higher dose than prescribed, and that can cause muscle breakdown, kidney stress, and cardiac complications that come without any obvious warning signs. But grapefruit is just the beginning. Let us talk about something even more common and arguably even more dangerous for the heart in older adults. Non-steroidal anti-inflammatory drugs, which most people know simply as NSAIDs. These include ibuprofen, naproxen, and a handful of other over-the-counter pain relievers that are sold everywhere and taken by millions of people without a second thought. NSAIDs are effective for pain. Nobody is disputing that. But for people over 60 who are also taking blood pressure medications or heart medications, taking NSAIDs regularly can work directly against those prescriptions. NSAIDs can cause the body to retain sodium and water, which raises blood pressure. They can reduce the effectiveness of certain blood pressure medications. And they can put significant stress on kidney function, which, as we discussed, is already naturally declining with age. For someone with existing heart disease or heart failure, even short-term regular use of NSAIDs can trigger fluid retention serious enough to worsen their condition and increase the risk of hospitalization. Multiple medical organizations, including the American Heart Association, have issued guidance on this. But the message has not reached enough people. Millions of older adults are taking ibuprofen for their arthritis pain while simultaneously taking medications designed to protect their heart, and those two things are working against each other every single day. Now here is where I want to talk about something that gets almost no attention, but that researchers and cardiologists have become increasingly concerned about. The relationship between certain common medications and what happens to your heart during the night. Here is a fact that many people find surprising. Your heart does not simply tick away at a constant rate around the clock. Your cardiovascular system follows a natural rhythm that is tied to your body's internal clock, known as the circadian rhythm. Blood pressure is naturally lowered during sleep and rises sharply in the early morning hours before you wake up. Heart rate variability changes throughout the day. Even the stiffness of your arteries fluctuates according to this internal clock. This matters for medications because when you take a time-sensitive drug can affect whether it works in sync with your body's natural rhythms or against them. Research has shown that for certain blood pressure medications, taking them in the evening instead of the morning can significantly improve their effectiveness and may offer better protection during those high-risk early morning hours when the risk of heart attack and stroke is statistically elevated. Yet most people take all their medications in the morning because that is what they were told when they were first prescribed, and nobody ever revisited that decision as their health picture evolved over the years. The one-size-fits-all approach to medication timing is a real and underappreciated issue for older adults. And speaking of things that nobody revisits, let us talk about the elephant in the room when it comes to senior medication safety. The prescription itself. When you are first prescribed a medication, your doctor bases the dosage on your current weight, your current kidney function, your current liver function, and your overall health picture at that moment in time. But for many older adults, especially those managing chronic conditions, the prescription might have been written years ago. Your body has changed since then. Your weight may be different. Your kidney function may have declined further. You might have developed new health conditions. You might be taking additional medications now that were not part of the picture when the original prescription was written. And yet in many cases, Nobody goes back and systematically reevaluates whether the original dosage is still the right one. This is a known and well-documented gap in healthcare for older adults. Studies have shown that a meaningful percentage of adverse drug events in seniors are related to medications that were appropriate at the time of prescribing but were never reevaluated as the patient's physiology changed. For the heart specifically, this is critical because cardiac medications like digoxin, certain diuretics, and some antiarrhythmic drugs have what is called a narrow therapeutic window. That means the difference between a dose that works and a dose that causes serious harm is actually quite small. Now I want to pause here for a moment and be direct with you, because I know some of what I am saying might feel a little alarming. The goal is not to scare you away from your medications. The medications your doctor prescribed were prescribed for good reasons, and stopping them without medical supervision is not the answer. The goal here is awareness. Because the more you understand about what is actually happening inside your body when you take your medications, the better equipped you are to have productive, specific conversations with your healthcare team. And those conversations can genuinely protect your heart. There are a few things I want to encourage you to do based on everything we have discussed. First, if you drink grapefruit juice regularly and take any prescription medication, look up whether your specific medication is on the grapefruit interaction list. Many pharmacists can tell you this in less than 2 minutes, and it is worth asking. Second, if you regularly take over-the-counter pain relievers and you also have heart disease, high blood pressure, or kidney issues, this is absolutely worth discussing with your doctor. There may be safer alternatives for your pain management that do not carry the same cardiovascular risks. Third, if you have been on the same medication at the same dose for several years and your health has changed since then, ask for a comprehensive medication review. Many primary care physicians and geriatricians are happy to do this, and it can catch problems before they become emergencies. Let me shift now to something else that I think deserves its own spotlight, and that is the issue of supplements. Vitamins, herbal products, and over-the-counter supplements are so embedded in American wellness culture that most people genuinely do not think of them as substances that can interact with prescription drugs. But some of them absolutely can, and the heart is particularly vulnerable. Take fish oil, for example. Fish oil is enormously popular, and in moderate doses, it does have genuine cardiovascular benefits. But at high doses, it has blood-thinning properties. For someone already taking a blood-thinning medication like warfarin, adding high-dose fish oil without telling their doctor can tip the balance too far and increase bleeding risk. St. John's wort is another one. It is sold as a natural mood support supplement, and many older adults take it for mild depression or anxiety. But St. John's wort is a potent inducer of the same liver enzymes that grapefruit deactivates. It speeds up the breakdown of many medications, including some heart drugs, meaning those medications are clearing your system faster and may not be reaching therapeutic levels. The result is that a medication your doctor prescribed to protect your heart may not actually be doing its job effectively. This is not a hypothetical. There are documented cases of patients on stable heart medications who experience complications after starting St. John's wort without informing their doctor. And the connection was not made immediately because nobody thought to ask about supplements. Magnesium is another example worth mentioning. Many older adults take magnesium supplements for sleep, muscle cramps, or bone health, all completely legitimate reasons. But magnesium can interact with certain antibiotics and certain heart rhythm medications, and at high doses it can itself affect cardiac conduction. The timing of when you take magnesium in relation to other medications matters as well. None of this means you should throw out your supplements, but it does mean your healthcare team needs to know everything you are taking, prescription or not. And it means you should approach supplements with the same thoughtfulness you bring to prescription medications, because the line between them is blurrier than the marketing suggests. Now let me bring this all together with something that I think is genuinely empowering for anyone navigating medications after 60. There is a concept in pharmacy and geriatric medicine called the brown bag review. The idea is simple and beautiful in its practicality. You gather up every single medication, supplement, vitamin, and over-the-counter product you take. You put them all in a bag, and you bring that bag to your next appointment with your doctor or pharmacist and say, I want to go through all of this together. This one simple act can catch timing conflicts. It can identify grapefruit or supplement interactions. It can reveal duplicate medications or doses that need to be updated. Pharmacists in particular are extraordinarily well trained for exactly this kind of review. Many community pharmacies will do comprehensive medication reviews at no extra cost, and this is one of the most underutilized services in all of healthcare. The research backing this approach is strong. Studies have consistently shown that comprehensive medication reviews in older adults reduce adverse drug events, reduce hospitalizations, and improve quality of life. It is not complicated. It does not require a specialist. It just requires the awareness that this needs to happen and the willingness to ask. And on the topic of asking, I want to briefly touch on something called the start low, go slow principle. This is a guiding philosophy in geriatric medicine for introducing new medications to older adults. Because of all the physiological changes we discussed, older bodies often need lower starting doses than younger adults and need more gradual dose increases to find the right therapeutic level without overshooting into a range that causes side effects. When this principle is respected, it dramatically reduces the risk of adverse events. When it is not respected, whether because of time pressure, incomplete medical history, or simply the habit of prescribing the standard adult dose, the risk goes up. If you or a loved one is starting a new medication, especially a cardiac medication, it is completely appropriate to ask your doctor about starting at a lower dose and titrating up carefully. A knowledgeable physician will not be offended by that question. They will appreciate that you are thinking carefully about your care. I also want to address one more thing before we wrap up, and that is the issue of medication adherence versus medication overload. There is a well-known problem in senior health care where patients are prescribed medications they genuinely need, but they start skipping doses or splitting pills because of cost, side effects, or simply the complexity of managing so many drugs at once. At the same time, there is a growing body of research suggesting that a meaningful number of older adults are actually taking medications that are no longer necessary or that carry risks that outweigh their benefits. Balancing these two realities requires an honest, ongoing conversation with your healthcare team. It is not a conversation to have once and never revisit. Your medication regimen should be a living, evolving thing that adapts as your body, your lifestyle, and your health status change. And if you feel like you are not getting that level of attention and follow-through, it is completely reasonable to ask for a dedicated medication management appointment or to seek a referral to a pharmacist or geriatrician who specializes in exactly this. Now I have covered a lot of ground today, and I want to make sure the core message is crystal clear. The medication mistake that puts so many hearts at risk after 60 is not dramatic or obvious. It is quiet. It is the grapefruit juice that nobody warned you about. It is the ibuprofen you have been taking for years without realizing it is working against your blood pressure pill. It is the supplement on the shelf next to your prescription that your pharmacist does not know about. It is the dose that was right for you 5 years ago, but has not been reevaluated since. It is the timing that was never optimized to work with your body's own natural rhythms. Any one of these alone might be manageable. But layered together, in a body over 60 that processes everything more slowly and has less physiological reserve, they can and do lead to real cardiac consequences. The good news is that every single one of these issues is addressable. And the tool that makes them all addressable is the same tool that costs nothing except a little time and a willingness to speak up. That tool is communication with your healthcare team. Before I wrap up today, I genuinely want to hear from you, because I know that what I have shared today is going to resonate with a lot of people in different ways. Maybe you recognized your own routine in something I described. Maybe you just realized that you have been drinking grapefruit juice every morning with your blood pressure medication and nobody ever told you that was a problem. Maybe you have had a medication review recently and you want to share how that went. Or maybe you have a question that I did not cover today. Whatever your experience is, drop it in the comments right now. Your story might be exactly what another viewer needs to hear to take action and protect their own health. And if this video helped you or gave you something new to think about, please share it with someone you care about. We all have people in our lives over 60 who are managing daily medications and who deserve to have this information. Sharing this video could genuinely make a difference for someone you love. I read the comments on this channel regularly, and your feedback shapes what we cover next. So tell me, has your doctor ever done a full medication review with you? Have you ever experienced an unexpected side effect that turned out to be a drug interaction? I want to know, and I will see you in the next one.